if you deal with frequent headaches or migraine attacks, there's a good chance that you've felt that deep nagging tightness or stiffness in your neck and shoulders. And you've probably tried stretching that pain away, but really that never provides good relief. So here's the truth. That tightness isn't because your muscles are short, and stretching isn't going to really fix it. So as a physical therapist who works with patients every day on this, I'll explain what's really going on with the neck, why you're feeling that tightness, and what actually works to help relieve it, both in the short term and in the long term. So hello, I'm Dr. Sam Kalakaitis. I'm a physical therapist that focuses on the treatment of headache and migraine disorders, like migraine, tension headache, cervicogenic headache. And I help people who feel that tightness every day. And more often than not, what they need isn't more stretching to relieve that pain. So let's talk about what people actually need or what they usually need. So let's talk about what that tightness really is. So for most patients that I see, that describe this kind of like constant feeling of neck and upper trap tightness, but during the physical exam, it's clear that those muscles aren't in a shortened state. They have normal range of motion when they're moved passively. That is actually just a sensation that you're feeling. It's not really a structural issue. It's a protective response of the neck. So the muscle tightness is often that it's just a sensation. It's literally just nothing shortened. And that sensation is your body is trying to tell you something. So why are we feeling tightness then? So there could be a couple reasons. One is you've been in prolonged postures or static positioning. Sitting in one posture for too long leads to muscle fatigue, and muscle fatigue makes muscles achy and it makes them feel tight. Another reason could be ischemia or reduced blood flow to those muscles. When you don't move, the muscles of the neck and the upper back don't get the oxygen supply they need, so less oxygen leads to more discomfort, leads to a feeling of tightness, right? So changing positions, restoring circulation, exercising can really help relieve that achiness and the tightness you're feeling. Another reason is weakness or lack of endurance of those muscles. So here's something that people don't really realize is like when muscles lack strength and endurance, especially ones that support your head all day, they'll start to feel tight if they're weak. And that tightness is your body's way of compensating for the feeling of instability or inability to hold your head up. So research even links low neck endurance to increased levels of pain in those with headache disorders. So it's not just about relief, it's about prevention as well. So let's talk about why does stretching fall short for most people? So stretching might feel good for a few minutes, like while you stretch it feels good, but it's not really what you want to be doing in the long term. It doesn't change the underlying issue. If your muscles are getting tired or they're weak, pulling on them more doesn't help them. It just provides temporary relief. So what really does work and what can you do instead? So one is change positions more often. The fastest way to really break up that tightness cycle and that neck pain cycle is to move more often. So you can set reminders, shift in your seat, go from sitting to standing, do short mobility drills, whether they're sitting, laying down, or standing, like every 30 to 60 minutes. The other thing you can do is starting to build strength with resistance exercises. To really change how your neck and shoulders feel and to function, you need to be making them stronger and more resilient. This means resistance training, and not just the neck, but also the upper shoulders, because there's a connection between the neck muscles and the upper shoulder muscles. So here's what the research kind of shows in regards to like resistance training, what you can do to what we should focus on. One, improve postural muscle endurance. We want to improve blood flow to the local muscles and increase capillary density so the muscles have more oxygen. We want to raise your pain thresholds, making these muscles less reactive to your daily stresses. So over time, strong muscles feel less tight, and even your day-to-day posture doesn't even have to change that much. So if you want a structured way to build strength for headache relief, check out the link in the description for my neck and shoulder exercise programs. If you're stuck in a loop of daily tightness and neck pain, and you don't really want to settle for more stretches that never really solve the problem, we should start moving more throughout the day and start getting stronger. This is really how we start to reduce that muscle pain, how we improve your postural muscles to support you, and how we lower the frequency and intensity of your headache attacks. So again, I've linked some programs or information about them below if you want to help getting started. And if you've got questions, please drop them in the comments. I'm here to help, and I'd love to help you guys really manage your neck pain and your headache disorders.